Well, hello everybody. Welcome once again to another one of our In Conversation series, and this time we're talking research, all things research, with a relatively new designated National Institute for Health and Care Research, HealthTech Research Centres. So you'll hear us talk about NIHR, HRCs. That's what we're talking about because we can't help ourselves on these things, but talk about but use acronyms. It's particularly pertinent. We're recording this mid-May, just after the May Bank Holiday 2025. And only a week ago, we were joined by many of you actually up in Manchester, the fabulous City Labs, to hear about some of the assets they have across the Manchester Foundation Trust, but also the wider Greater Manchester health and care ecosystem. And we heard a lot about the NIHR assets there today. So this is a bit of a double header. I've got two guests with me today. I've got Annie Yarwood, who's going to talk to us about the HealthTech Research Centre in Emergency and Acute Care, which is based out of Manchester. And then we have also Daniel Taylor, who's then going to pick up on some of the aspects of patient and public involvement and some of his experience working with some of you and companies in our sector. And that's something we know is dearly important. It's probably an under-visited topic of conversation for us. Before we get started, as we always do, I'm just going to ask you both to just introduce yourself, give us a sense of your background, which has led you to being on this call today. So Annie, do you want to kick us off?
Thanks, Richard. Thank you for having us. My name's Annie Yarwood, so I'm the Operations Manager for the NIHR HealthTech Research Centre in Emergency and Acute Care, which, as you said, is based in Manchester University NHS Foundation Trust, one of the biggest trusts in the UK. So my background is in science, so I started off as a scientist, did my PhD at the University of Manchester in genetics, and then kind of worked in academia for a while as a research fellow, and then kind of moved over into the trust into a more operational role.
Great, thanks, Annie. It's great. Welcome. Daniel.
Hi, so I don't come from any research background myself, and I've worked in public and patient involvement for about 11 years now, doing a real range of roles. So I've worked centrally across a whole university before. I've worked within a Wellcome Research Centre where I had to do everything. It's the first time I'd gone from supporting everyone to do PPI to doing it myself, which was an education. And then in order to move to Manchester, I worked in some national roles in charities. So I worked at the British Red Cross and then the Stroke Association, which is a really interesting place to work, before coming here to the HRC, where I'm also connected to a group called Vocal, which is all PPI specialists. And what that means is that we support partnerships between public and patients affected by research with the industry partners and the researchers who are trying to make that better and develop better ways to treat people.
Right, thanks, Annie. Really interesting background. Look forward to hearing from you in a moment. Just one thing, just clarify that acronym for us, PPIE, and then we'd have to spell it out again once we've done that.
It's terrible for the person whose job it is to make sure that everything's accessible to everyone to use terrible acronyms. So the full acronym which you tend to use is PPIEP, which in itself is quite a long one, but basically it means patient public involvement, engagement, participation. And it's meant to cover all the different ways in which we can involve public and patients as equal partners in our work.
That's great, thanks, Daniel. And there's always competitions, aren't there, for the longest acronyms, and anything with NIHR in front of it tends to be up there. Okay, Annie, back to you, lad. Could you just give us, you're not the only HealthTech Research Centre in the country. Maybe you could just give us a very, very high level overview of the programme, where it came from, what it's looking to do, and then if you'd like, dive a little bit into your specific HRC.
Yeah, so the NIHR designated 14 HealthTech research centres across England, with the aim of supporting the development of health tech in terms of evidence generation for novel health technologies. So the HRCs were designated about a year ago. Previous to that, there was a programme called the MICs, the MedTech In Vitro Diagnostic Cooperatives, which some of the centres were previously MICs, but we are one of the new HRCs. So each of the 14 HRCs has a different speciality focus area. So ours is emergency and acute care. And we want to kind of transform emergency and acute care by driving that commercial development of health technologies that can inform clinical decision making, improve diagnosis, optimize treatment, and get patients kind of the right care in the right place at the right time. So I guess we, thinking about emergency and acute care, I think 60,000 people walk into A&E or walk-in centres and things like that across England every day, and 18,000 of those patients are generally admitted to hospital. So, HealthTech's got a real potential to revolutionise healthcare delivery in those areas. And specifically, we talk to lots of different companies who have technologies that could, monitor people for deterioration, kind of let us know which patients can be managed at home in a better way, diagnose people earlier, get people better treatments. So all of those things, all of those technologies are technologies that we want to get into the NHS quicker, essentially. So our kind of health tech research centre looks at these technologies, and we want to support companies to progress those innovations down the innovation pathway. And a lot of that is through evidence generation. So we usually speak to companies who are at the early phase of development. So they've got a prototype or a technology, and they need to kind of progress that through to clinical validation, clinical utility studies, and we can support them to do that. So we do have kind of 4 themes within our HRC. So although we say we're focused on emergency and acute care, we do look at community-based technologies as well, so very much thinking about that prevention aspect that the government is very interested in, and moving stuff out in care out into the community. One of our themes is focused on the community setting, primary care, as well as ambulatory settings, and A&E as kind of the interface between primary and secondary care, and kind of looking at technology that could ease pressure on those services, preventing people presenting at A&E, diagnosing them earlier and getting them treated sooner. We then have a theme that is focused on secondary care, acute settings. So again, kind of getting people quicker diagnosis in a hospital setting. And we have a lot of expertise in our centre and in our trust around cardiology, respiratory medicine, critical care, infectious disease, and pharmacogenomics. So we have a big focus on those areas, but that doesn't mean to say that we won't look at other technologies in other areas of acute care. And then we kind of have a couple of themes which are focused on methodology, and although we have these different themes, they all kind of work synergistically together and overlap in terms of projects and working with companies. So our methodology cluster, we have a theme that's looking at really understanding the problem. So, thinking about which population is going to benefit from that technology, what's the current care pathway, what's the scale of the challenge that you're trying to address in terms of health and the economy, and how the technology would change that. And then we have a theme that's kind of looking at evaluating the solution, so designing and conducting clinical validation studies, clinical utility studies, looking at the health economics, and implementation science, as well as looking at things like behaviour change, and really ensuring that technology is ready for market access. So all of those kind of themes work together within the centre, and those kind of expertise that we have, we can kind of offer those to companies. We have a team of project managers to help manage projects as they come through the centre. So we really work with companies to assess their technologies and bring all of those, the right people in the room, essentially. So we have a kind of prioritisation process at the moment where our core team talks to the companies, gets them to fill out some forms about their technology, what kind of technology readiness level it's at, what evidence they've generated so far, and what they're looking for in terms of support. And then we take that to our panel of experts, which includes clinicians, methodologists, and they'll kind of review that technology and provide advice and feedback on what they think the next steps are. And then we can take that forward into a project and start building the project team. So, whether they need methodologists and health economists, whether they need more clinical input and all of that kind of thing. And I think the value of, working with HRCs is kind of bringing all of those people together in the right room to help in terms of co-development of that technology, and really increasing the likelihood that that technology will fit into the system. So yeah, just bringing all those people together and making sure that the technology really fits a need that we have in the NHS, and making it more likely that it will be adopted into the NHS essentially.
That's great, Annie. Thank you. You answered a lot of questions there about what companies might expect when they come to you. And your themes there are actually quite broad, aren't they? Emergency and acute covers quite a lot, and then you've also got that community element and the diagnostic as well. So that's great. So if we'll put this in the link when this goes out, but if companies think they have something in your space, how would they go about? Do they come to you individually? Do they go centrally?
So they can go, we have a website, they can go to our website, and on there we have an inquiry form that they can fill in, or we have a generic kind of email address we can share with people, which comes to our HRC inbox, and then one of our core team will engage with them.
And from the form there, is it quite clear what is expected of companies at that first meeting, what they need to prepare for?
Absolutely, yeah. I mean, one of the core team will generally meet with the companies to explain again, what the HRC is, how we can support them, and kind of support them in the filling out the form that we have. And then they can go away, add a bit more detail to that, and then they'll meet again with our core team before we send that the information to our prioritisation panel. So yeah, all the support's there. And we're eager to collaborate. That's essentially what we want to do. We want to get these technologies progressed further. And I guess, we have the people who can support study design, which is a big thing. So, making sure that when we're conducting studies with companies, a lot of these companies have got financial barriers, they're small companies, to make sure that we get the most out of those studies, so that we're demonstrating, we're validating the technology, but also demonstrating utility, and it's got value, and it's going to make a change to the NHS, because that's really what we need to see to then progress forward to adoption.
That's great. And then we mentioned that you're part of a national resource, so is there some signposting built in there where if someone came to you and the technology wasn't right, you could say, well, actually, you need to go and see our colleagues in Leeds or wherever else?
Yeah, absolutely. Yeah, definitely. If they come to us and it's not the right place, we'll definitely send them to another bit of NIHR infrastructure.
That's really helpful, because actually navigating that and getting in the right place is very, very tricky. And I think we should say, and we'll do one of these in a future discussion, there is a HealthTech Research Centre network which provides that national resource, and hopefully some from signposting, which is I think managed out of Sheffield. So that's great. So Annie, that was great. Daniel, to you then. I was sort of party to or involved in the designation process as one of the panelists. What was a real requirement for all the organisations was this PPIEP, a real commitment to that and demonstrate that. You've got a wide experience, wide background in this. Maybe you'll just want to bring that to life a little bit, what it actually looks like, what it means. Say a little bit about your current arrangements, if you like, in Manchester for this HRC. Then also maybe some top tips for companies who may be starting out on their own patient and public involvement journey as well, and also what you might expect to see from a company coming to you.
Yeah, absolutely. Thanks, Richard. And tell me if I miss any of those answers. There's a lot to cover with PPI, particularly so in my role starting at the centre. I've been talking to a lot of companies about what their knowledge of this already is, kind of how it's looked when they've come in contact with funders, and kind of what the understanding is that they get from those interactions, because PPIEP is a really core requirement of pretty much all the large medical funders, and as we're funded by the National Institute for Health and Care Research, it's something which is, as you've said, really baked into the application that we had to put forward and the way that we work. You asked what is it? A lot of people aren't sure, because it's quite vague terms really, but NIHR have done really well at what I think is putting together a really great description where it talks about public involvement as an active partnership with patients, carers, and members of the public that influences and shapes research. So it's research carried out with and by members of the public rather than to, about, or for them. I'm a big fan of that first half of the definition, particularly because I feel like it's really practical. Involvement can look a whole range of different ways, and it can have a whole range of different purposes in product design and research. So it can be hard to pin down. It could be design workshops with the public to co-produce those technologies. It can be arts collaborations where you try and understand people's kind of core needs and the kind of patient-centered outcomes that you might need to pursue. Or it might just be regular meetings around a table to govern and shape product design and your projects throughout. But as long as you can demonstrate that it involves those key terms in that definition, so active and equal collaboration with the public and patients in a way that genuinely shapes and influences research, then what you're doing is probably involvement. If it feels like a kind of give and take rather than telling people or receiving information from people, then it's got a really good chance of being well regarded by funders, certainly. I think to do this, the key thing to do is to think of people affected by your research or your product in the same way as you'd think about other expertise. So think of public and patients in the same way you might need to incorporate user experience or health economics expertise into your team. And if you're not too sure, NIHR and other major funders really do have a lot of information about that on their websites. There's a lot of guidance, sometimes overwhelmingly so. So that's kind of what it is. Hopefully that brings it alive a little bit. Richard, do you want to give me what you think is the next important question? Because otherwise I'll just go off on one. What do you think is the next thing that you'd like to know?
Let's start before we get into specifics of what you're doing in Manchester. Top tips for a company really starting out on this journey, perhaps not thought about this before. There's been, obviously, it's been more high profile recently, hasn't it, about engaging people in research and how we avoid excluding people from research. You're a new company, once with a new product, starting out on some research. Where would you start in terms of pulling together that element of your work?
Yeah, and I completely agree with you. It's always increasing in its relevance and its importance, but we really recognise that actually there's a lot of support typically within research infrastructure for this, but actually the companies that we work with don't have access to that same training. So it's really important to get that advice on where to start. And so we always ask the same 4 questions in the same order, really. So the first question to ask is, what is the purpose? You're putting together involvement with people. Why might you do this? In what way might that expertise, that lived expertise, shape the work that you're doing? And really think about not just kind of vague ideas, but if you ask that question to people, how that might improve the way that you work. So rather than just, we want to hear from people because we want to get an idea of their values or kind of what they need in healthcare, thinking, okay, how does that match to the product we're developing? If we're doing something that involves interaction with patients, then we need to understand what that interaction looks like to them, what they need for that to be clear so they can give us the right information and also have the experience that they need to feel that they are going through that recovery. It might be if we're developing diagnostic tools, then actually the way in which we develop those parameters and those outcomes, we don't understand what the most important outcomes are for patients. So how can we involve them in that specific work that we're doing? So really thinking about the specific purpose for your own product, then thinking about who you need in order to answer those questions. And again, trying to get really specific with that. So, any question has people with relevant expertise, and thinking not just kind of everyone who's affected by the condition area you're working in, but who might be, say, a really high intensity user, or who might be someone who might face additional barriers to taking part. As you said before, health inequalities is really important at the moment, in that recognition that we can be developing technologies which basically improve care for the same people, or we can be looking at actually how do we cover some of these huge gaps which can really kind of improve the reach of the work we're doing, and which also looks great, well, is great for NHS commissioners, because we're all looking at how we can, find ways to provide better treatments for people who might be locked out the system right now. That's your two biggest questions. We then will ask, what's a good way of bringing those two things together, and how do you ensure impact from that? But the two places to start are, why are we doing this? How will we shape our work? Who do we need to specifically involve in order to do that? And that will give you the basis.
That's great. Daniel, maybe finally something, do you want to say anything about your particular approach to in Manchester, and maybe how you link with Annie and other people in the HRC there?
Yeah, absolutely. So PPI flows through everything that we do. I've given support and training to our project managers, so when they meet companies, they'll be able to give that advice in terms of the core things to think about, how to start shaping your ideas. And as that form is filled in, there are two relevant PPI questions, so people will be able to use that time to consider. We don't need perfect answers. We just want to know what you think that might be. And then our whole role is to shape that together. I'm on that prioritization panel that Annie spoke about, so I will give feedback along with our academics on PPIE. And our academics are really good. It's really good doing that together, because I have that side of expertise, but I don't have the research and the clinical knowledge. So they're really good at identifying additional feedback for that. And then once we've gone through that, then everyone is offered an hour's advice meeting with me. We can put them together with patient collaborators as a kind of quick initial meeting where they get to actually talk to people who are affected by their work. That's something that we're still putting together, but we're very interested in kind of giving a go with people for a small fee of those contributors' fees, because we always meet NIHR guidance on paying people £25 an hour to recognise their expertise. And then, of course, any collaborative projects that we work on, PPI has to be part of that because it's required by funders, it's required by regulators. So I am part of that process. And what we look to do is to build in the relevant patient expertise. So the goal is that either we can bring in a PPI specialist if the company needs that, or I can bring people together, create that framework, and then let people go and just check in when needed. But yeah, kind of following what Annie said about the role of the HRC more widely, I really recognise that there isn't PPI training or specialists for companies out there. So I want to be that person when we're having collaborations, because it's really, really vital and really valuable to product development. But it's understandable that a lot of the people you work with don't know what it is, don't know how to get started. It can be really messy, which is a good thing, but it can help to have someone who can reassure you, guide you, point you to the right places.
Well, that's fantastic. Thank you. And it we have an ongoing relationship with Manchester and MFT, and it's the third year I think we've been up there last week as part of that relationship. And I think you've really illustrated today why that's so precious to us, as well as being the largest acute hospital in the country. I think most people would agree Manchester is. I also think you've got the largest concentration of NIHR infrastructure as well. So you've really helped bring that to life together. We'll put, I'm sure there'll be lots of questions heading your way after that. Hopefully we can share your details if you're okay with that, and we'll let people know how they can get hold of the HRC network generally, but also specifically for you guys in Manchester. So thank you very much again for your time. It's been great to talk to you.
Yeah,
thank you, Richard.
Thank you.